Oh, hello. It's me, Laura, and I'm going to talk to you today about my gallbladder, specifically my gallbladder disease. I know I'm a little bit breathless at the moment. It might be due to anemia, I'm not sure, but I'm going to first of all do a little bit of an introduction on the gallbladder. Information is from Wikipedia and the NHS website as well. So I'll just put my glasses on. I am wide awake actually. I've just got heavy lids. Okay, that's better. I think you can see my eyeballs now. Yeah, you may have noticed I've got thinner. Oh, I haven't shaved my armpits. Oh, it's not summer anymore. Got a nice top on. I got from a charity shop recently. I'm a size 14 now. It's a size 16. So the best diet I've found that worked for me is the gallbladder disease diet. You don't want it, honestly. All right. What is the gallbladder? Well, my liver's here, and underneath the liver is the gallbladder, and it's tiny. It's only about that big, about the size of an egg, and it's round. I don't know what colour it is though. All right. The gallbladder is a small pouch-like organ found underneath the liver. So when it's removed next year, they'll have to lift my liver up and remove the gallbladder. So I still got it. The main purpose of the gallbladder is to store and concentrate bile. Bile is a liquid produced by the liver to help digest fats. It's passed from the liver into the gallbladder through a series of channels known as bile ducts. Ducts. Not ducks, ducts. Gallstones, which usually start off with gallstones and they can get bigger, and that's when they pose a problem. Gallstones often have no symptoms, but if a gallstone becomes trapped in an opening, a duct, inside the gallbladder, it can trigger sudden, intense pain in your tummy that usually lasts between 1 and 5 hours. This type of abdominal pain is known as biliary colic. Some people with gallstones can also develop complications, like what I got, such as inflammation of the gallbladder. This can cause persistent pain, jaundice, which is yellowing of the skin and the eyeballs, and a high temperature. All right. Yeah. So, when was it? Lost track of time. We're in November now. So I think it was towards the end of October, for about a week or two, I started getting this horrendous pain, and it was virtually all day long, and nothing would relieve it. I tried all sorts of remedies. I couldn't eat in that time. I found it almost impossible to eat anything. And then it came to me that I'm not going to make a doctor's appointment because that could take months to sort out the problem. What I'll do is I'll go to A&E, which in the UK stands for Accident and Emergency, or ER in America. So I walked there. I think I walked, or I may have got a cab. I can't remember. Those days were a blur. And I was admitted straight away. They told me, you've got gallbladder disease. I got inflammation of the liver as well, an infection of the liver. So I had to stay in. The first thing I had was an MRI, which I didn't like. I found it claustrophobic and noisy. but it had to be done. And then I was put into a ward. Yeah, it's surreal. I really can't remember those first few days in there. I was asleep most of the time. I was so tired. They put me on a drip. So I was on a drip for about, I don't think I was on a drip for the first day or so. But after that, I was put on a drip for like 4 days. It seemed like forever. And all it was basically was sodium, just water and sodium, and nothing else. Couldn't eat. I could drink water, and that was about it. So I found that really difficult. I didn't have an appetite either. And the funny thing is, I didn't have an appetite for smoking either in those days, in those early days. I didn't fancy a cigarette at all. I just spent the time talking to the other patients, and I don't really know what I was doing basically, just sleeping. Anyway, then I had to have this awful thing called an ERCP. I can't pronounce the last two words, they're too long. Um, but it's endoscopy. But it's not a straightforward endoscopy, it's an endoscopy with a procedure, which I would call surgery, but it's not quite surgery. Um, I was put into this ridiculous position because I've had frozen shoulders. I've got limited movement in my shoulders and arms now. So getting into that position was almost impossible. And I had to get into that position. It was like half on your belly and half on your side, with one of your legs cocked up, the other one straight, arm under the pillow, head like that. It's the way I used to sleep. It was my favourite sleeping position, but since the frozen shoulders, I can't sleep like that. I have to sleep on my side. So it took them ages to get me into the position. They were just manipulating me and sort of moving me about. And then they put this tube, and it was massive. It was about that thick. Oh, they did give me sedation. I said, "No, I've got a high tolerance to benzodiazepines. Can you make sure you give me extra sedation?" I didn't mention about the painkiller though, did I? Because I had a problem with opiates, so they probably didn't give me enough opiates either. Anyway, I don't know how long it lasted, but to me it lasted forever, and it was like torture. And I'm sure that there was two doctors, and I'm sure one of them was teaching. Yeah, I think one of them was the head doctor, the consultant. I think he was teaching the junior doctor, and that's, I think, why it was so painful. And not only that, the weird position of my body and my spine. My spine's twisted anyway, so yeah, they kept shoving the tube further and further down. I had to go through my stomach to the what's that? The first part of the small intestine. I forgot now what that's called. Yeah, I can't remember what it's called. As far as that, mainly to see what's going on, and also to try and remove as many gallstones as they could. And they were saying every time they said screen, and I wasn't allowed to watch it. They told me I couldn't watch it. Well, I don't know why I kept looking at it. I thought it might calm me down, but it just looked horrible. And every time they said screen, I knew what was coming. It was shoved in further, and because oh yeah, I had a mouth guard in as well when the tube went through, so I couldn't shout or scream or talk. All I could do was this groaning noise, like that. I shouldn't laugh now; it's awful. And Um, my face, there was tears running out my eyes, down my face, mucus coming out of my nose, and saliva coming out of my mouth. I just must have looked horrendous. And they must have known I was in pain. And at one point they said, give her some more sedation. But it didn't feel like I was sedated at all. And as for the painkiller, well, it's like they gave me a paracetamol or something. Um, I felt everything. I was awake. I know you're meant to be awake, but sort of sedated. But I didn't feel sedated at all, and I felt everything. It was torture, pure torture. But I'm not going to say, if anyone has to have that procedure done, don't be worried. Ask for extra painkiller if you think you might need it. Just say, I've heard that it's painful. For some people, it's not. At the beginning of the procedure, the doctor said to me, it's not painful. It's just a little bit uncomfortable. You'll feel some movement. Well, it was torture. I felt like I was in a torture chamber. It was awful. And apparently, I have to have another one done after my gallbladder is removed. But I'll probably ask for general for that. Yeah, that'll be the best thing. So if you don't like pain, where possible, ask for a general. All right. Well, after that, they came round and they said to me, um, uh, we were only able to remove some of the gallstones. We couldn't remove the ones that are stuck in the bile duct. I think there's just one. I'm not sure. I don't know. I know there's bile ducts in the gallbladder and the entrance of the liver, I think. But I'm not sure about the anatomy of it. Um, but there's a big one, I think, um, in the bile duct that leads to the liver. And they put a stent in, something called a stent. I don't know what it looks like, how big it is, or whatever it does. Well, apparently it drains sludge and toxins from the liver or the gallbladder. I'm not sure, but it drains all the nasties from getting into my liver and infecting my liver because my gallstones infected my liver and gave me jaundice. All right. Also, at that time, I was having intravenous antibiotics as well, quite a number of them actually, and also other medications like blood thinner. That was into my stomach, but I couldn't bear the pain. And I said, I'm walking around anyway, I'm mobile, I don't need it. Um, After the endoscopy, a doctor came round and she said I could have soup and I could have orange juice, yogurt, and jelly. Uh, so for a little while, I was a bit worried about having soup, so I just basically lived on black coffee, tea, black tea, orange juice, and jelly. And then I got brave enough, and I thought, I know, it had to be low fat as well, apparently. But the staff that were handing out the food didn't know because it wasn't written on the board behind my bed. It just said normal diet. Anyway, the soups all had cream in them, and they were quite nice actually. But the first soup I had, I asked for tomato. They said, "You want tomato soup?" There was three options of soup. I said, "I'll have tomato," and it had lentils in it. And I don't think my body could handle lentils. But they also said it could have been the antibiotics, but I had diarrhea, really bad diarrhea. And on a few occasions, I actually had accidents. I couldn't get to the toilet in time, and it was really, really embarrassing. Really embarrassing. I don't want to ever go through that again. And that happened on 2 days. For 2 days running it happens, and it put me off eating for a while, but I started eating again, just tentatively, and things sort of started to look normal. But when I did have the diarrhea, and for a few days afterwards, I was wearing these giant incontinence pads. They were massive. I think they'd fit an elephant, basically. It was difficult to get them in my pants. The screen's going blue, I don't know why. And yeah, they were hideous things. And the gowns we had to wear, I stopped wearing them as soon as possible and just put my normal clothes on, my pyjamas and the t-shirt. Because the gowns, they tie up at the back. Well, there's a way of tying them at the side, but it doesn't last long. And it moves, and then your back is exposed. And I didn't want people to see my knickers with the incontinence pads sticking out. Not a good look. And there was men, men visitors. Visiting hours were from 12 to 9. I didn't want men seeing my backside, honestly. And the gowns only came in one size, which I thought was stupid. And I noticed the men were wearing the same gowns as the women. Yeah, that's stupid. I thought they were going to design a new gown for hospitals. Or is that the new design? It's horrible. It's like something you'd wear in a workhouse, except you wouldn't have the back opened. It was that sort of material, like workhouse type of material. Horrible. And you sort of get strangled as well, because there was a bow at the back, and if you tied it into a bow, if you sat in a certain way up in bed or lie down, you get strangled. So you have to keep getting comfortable and adjusting yourself so you didn't get strangled by the gown. Uh, Being in hospital was quite a good experience. I was in there for 9 days, but it seemed like forever. But there were good points. Um, my bay had always had four patients in it, all female, obviously. And I met some brilliant women there, really nice women, and we'd laugh and joke, and that really helped to pass the time, chatting. And I started to get an interest because for a while I was a bit depressed, but then I started to liven up and started taking an interest in life. And my partner would come and visit me, and he'd bring up a wheelchair, and he'd wheel me down to outside the hospital, and I'd go for have a cigarette. Yeah, I started smoking again properly. Properly. I mean, a similar amount to what I'm smoking, what I smoke normally, which is too much. Um, yeah, they kept saying to me, low fat diet, and they gave me this diet sheet, and there was hardly anything I could eat that I wanted to eat. All the things that it said you couldn't eat were things that I was eating, so a lot of it was my fault. And while I was in there, I came off a sleeping pill. I won't mention it because I might get into trouble if I mention the name, but I was on a very high dose of this sleeping pill, and I'd been on it for years. And I was on, if an ordinary person took the amount I was taking, it would kill them. Yeah. I built up such a tolerance. I was on so many, it was ridiculous. And the psychiatrist came to visit me, and he said, "You've got to come off it because we think it's what's called your gallbladder problem." So I had no choice but to come off it, and I had to come off it cold turkey. They were meant to give me something 3 times a day to help with the withdrawals, but they conveniently forgot. I think some of them are sadists, and they wanted to see me suffer for some reason. And funnily enough, I was just given like a tablet at night, half a tablet. I found out it was a benzo. It was enough to send me to sleep. The white one, I don't know what the white tablet was. It was half a white tablet that helped me to sleep. Then they started giving me half a blue tablet, which was half a milligram of something. Half a milligram, nothing. It didn't help me to sleep at all. Especially in the hospital, it was like an oven. Absolutely like an oven. I was right near a window, but I could only open it about an inch. And all the women just kept complaining that it was too hot. So we had fans on all the time. But it was just blowing hot air around us, really. It wasn't doing a lot. So, what's it like in summer? So they have I don't think they've even got air conditioning in hospitals in this country. I'm not blaming the NHS, they did a marvellous job. But I had about 3 or 4 teams working under me. Well, that sounds a bit weird, doesn't it? But they were very nice. Some of them were miserable, but most of the staff were brilliant. I gave some of the staff names. Um, Mussolini was one, Casanova was another one. Um, I forgot now. There was a few others, Dollface. Oh yeah, I must tell you about the Zopiclone withdrawal. Oh, I just mentioned it. I must mention the sleeping pill withdrawals that went on for about 5, 6, 7 days. They did get easier, but I found the first 2 days, 2 or 3 days, the worst. My sense of smell was so heightened. I could smell someone who had been eating garlic, who was in the corridor outside my bay. And the Filipinos were the worst for eating garlic. We had all sorts of staff coming in, doctors, etc. Middle Easterners, Indians, people from Africa. I don't know what countries, but African countries, all sorts of people. But I always knew when the Filipinos were on because of the smell of garlic. And not only that, the hand sanitizer and the hand soap, I could not bear to smell it. It was so strong. The smell would just make me feel sick. It was so heightened. It was awful. One night, I thought, I can't take any more of this smell. All I could smell is garlic, hand soap, and hand wash. And the combination of it was just really disgusting and awful. Then I got very, um, what's the word? Uh, mine's gone black. My memory has got better since I stopped the sleeping pills, by the way. Yeah, lights, bright lights, strip lights, noises, especially at visiting times when there was a lot of visitors. And outside the corridor, sometimes it sounded like a pub, inside a busy pub, or something like that. If you do get busy pubs anymore, I don't know. But the noise, the lights, everything was too much for me. But I just put up with it, and somehow I got through it. But that was a really difficult thing. And I think if I hadn't been taken off cold turkey off this medication, life had been a lot easier for me. And of course, the diarrhea didn't help either. And then I started eating normal meals, and that's when I started to get better. Everything improved, but I lost about a stone in weight, if not more, which I was quite pleased about. I could pull my jeans down without undoing them. Yeah, so that was one bonus. I'm sure when my gallbladder is finally removed and I can eat a more or less normal diet, I probably still have to watch my fat intake. Um, but I hope I don't put all that weight back on. So I'm not being a saint at the moment. I do have the odd cake now and again. I do not like skimmed milk in my tea. It's disgusting. I have black coffee without milk. That's got caffeine in it, so I only drink about 1 or 2 cups a day. So, yeah, I try to buy low fat options and cook low fat as well. So, I don't know if I was only planning to do a little bit of the video and make it into a series, but I've more or less covered everything. So, I think it'll be February when my gallbladder's removed. So I'll let you know how that got on. I'm not really too frightened about having a general. I met the consultant a few times, and he's a lovely man. Fatherly type, well, grandfatherly type. Well, for me, it'd be fatherly. No, he's probably not old enough to be my father, but he's a nice, elderly-ish man, and I trust him. Very kind man. So I think the NHS did a very good job. The only thing really didn't like about the hospital was the things I've mentioned, and I mention it again. It's just too hot in the hospital. Too hot. I don't think there's any need for it. Well, I know there's a few elderly people. I never got to see the elderly people because they're more or less confined to their beds. So I didn't really see many elderly people, but I'm sure there's quite a few. And we did have one elderly woman in our ward when I first got there. But what was strange was that she had this fan pointing at her head 24/7, and she had a blanket on top of her sheet. No one else had a blanket. And the nurse came and said, "Would you like another blanket?" And the old lady said, "Oh, yes, please." And I thought, she's got a blooming fan pointing at her head all the time. And there was a lot of people that didn't have fans. There was one woman, a similar age to me. She was fast asleep. She didn't have a fan, but her face was bright red with the heat. So I gave her I stupidly, well, no, stupidly, I didn't stupidly give her my fan. I decided to give her my fan out of the goodness of my heart. And then I heard that same day that the old lady was being moved into a different ward. And I kept my eye on that fan. And as soon as she was out of that bed, I took that fan. I've probably got a lot of funny stories to tell you about. Oh yeah, psychiatric patient uh, followed me to my smoker's bench and started talking rubbish that he was a bomb disposal expert and he had like camouflage gear and he had these crosses saying Jesus, etc. Had hardly any teeth, and it was just really wasn't talking like a Christian at all. It was talking in a very weird, strange sort of way, and I knew he was from the local psychiatric unit in that hospital. And he kept touching my leg like that with his hand. I said, "Could you stop touching my leg, please?" And he didn't like that. He started to get angry. And it was quite dark. I don't know what time it was. I don't think it was later than 9 o'clock. And luckily I spotted a nurse, or what looked like a nurse, a female. Yeah, young female woman who looked like a nurse. I called out to her, "Oh, hello, can I, can I come and walk with you, please?" And then I told her, and she said, "Are you going to be all right? Do you think you should report him?" I said, "No, no. Think he's probably not even sectioned, because if he was sectioned, he wouldn't be allowed out. So it's probably harmless." And then I went to another place to have a cigarette. I know you're not meant to smoke on the hospital grounds, but a lot of people do. And he started talking to another woman, and she was rummaging in her handbag. She gave him something, looked like a piece of paper or something. I thought it was money. I said, "You didn't," when he went, I said, "You didn't give him money, did you?" She said, no, I just gave him my name, but it was a made up one. And she thought it was funny, but I didn't. And yeah, that was one quite interesting, well, horrible story, really. And it took a long time to get out of the hospital to have a cigarette. By the time no energy. By the time I walked down the stairs, I was out of breath. And by the time I walked up the stairs and along the corridors, I was out of breath as well. Yeah, because I had no energy, really. A lot of it was from lack of food, a lot of it was from smoking, which was my own fault. And I have to be careful because if I carry on smoking, my lungs might get in such a poor state I might not be able to have my gallbladder removed, and that would be bad news for me. So I've got to think about that next. I had made lots of plans while I was in hospital, um, but none of them, I've not done anything about anything really, just making my videos. I won't talk about them now. I basically wanted to talk about my gallbladder and having gallbladder disease. It's not pleasant. Try and look after your diet. That's the most important thing, I think. It's most common in women over 40, overweight, over 40, overweight, white, and there's one more thing, can't remember now, but it can affect pregnant women as well. There was a young girl, 30, who had gallbladder disease, just like me, the exact same thing. Um, it is more common in women, but as you get older, men and women, it is sort of more or less equal. So when men and women get to about the age of 60, 60 to 70, it evens out, so it's like half and half. But smoking is a contributing factor as well. Alcohol, um, prescription medications, too many benzos, etc. Or too many medications of any type, really. Try and limit the amount of medications you take if you can. Look after your diet. Not, try and cut out all the sort of sugary, fattening things. And exercise is important too. So basically, try and live a healthy lifestyle. Look after your weight and look after your body generally. All right. I hope you don't get it. It was an experience anyway, and I look forward to telling you all about my removal of my gallbladder, and I'm going to ask him if I can keep it in a little glass of formaldehyde, but they'll probably say no. No, because they'll probably have to do tests on it, and it'll just end up in little pieces. But I'd like to have a look at it first, see what colour it is. Yeah, all right. That's the end of the video. It's quite a long one. You take care and look after your gallbladder. That's if you've still got one. Bye.